For those who do not know me, I am Cicero Kit, or I also go by Stealth in Second Life. In real life, my name is Jen Dolan. I am a member of Virtual Ability and the moderator for today's panel discussion. I have worked as a journalist in both real life and Second Life and worked in higher education and the nonprofit sector before going on disability in 2017. Fear and anxiety affects so many lives in so many situations. Today's panel includes a cancer doctor, a clinical psychologist, and a traumatic brain injury survivor who helps other neurodivergent individuals. I will have each person introduce themselves to you, and we'll start with Dr. Post.
Great, thank you so much. I've been taking care of patients with breast cancer as a nurse practitioner for about 18 years now at the Massachusetts General Hospital Cancer Center. I'm also a nurse scientist in the MGH Cancer Outcomes Research and Education Program and a member of the Harvard Medical School faculty. I spend most of my time conducting research to improve the quality of life and outcomes for patients with cancer and their families. My work is funded by both the American Cancer Society and the National Cancer Institute of the NIH. I'm so pleased to be here and speak with you all today about this important topic.
Okay, then we'll have Namara introduce herself.
And I think everybody can hear me. I also have a speakeasy. I want to thank you all for inviting me, and I'm super glad to see everyone today. My name is Namara McMorrock, Gloria Kraegel in that other life. I'm with the Brain Energy Support Team, which is a US-based nonprofit organization, works primarily with individuals with traumatic brain injury. Also the chief groundskeeper at Utopia Sustainable Communities, where we create supportive and engaging opportunities for neurodivergent persons and their families, loved ones, to build skills and systems for success in a space that reflects our passion for regenerative living in social, community, business, and environmental contexts. I do want to clarify that while the Brain Energy Support Team works with a variety of individuals, families, and groups from the neurodivergent community, we do not provide medical or psychological services, and you can find out more about us from our website. Thank you.
Thank you. And then I'll have Dr. Brosof speak.
Hi everyone, I'm happy to join you today. I'm Dr. Leigh Brosof. I'm a licensed clinical psychologist, and I have over 10 years specializing in the research and treatment of eating disorders. A lot of my research focuses on how to make digital interventions so we can make treatment more accessible for folks. And I also specialize in comorbid conditions like anxiety, depression, and suicidal thoughts. I'm happy to be here today with everyone.
The topic for today's conference deals with fear. As you all know, fear can sometimes be productive. For example, I have multiple sclerosis and am afraid of how further progression of my MS could impact my life. So I have regular MRIs, take medication, and engage in physical therapy to help mitigate that. What are some ways in which fear may be productive for the people you work with? And once again, we'll start with Dr. Post.
Thank you. So I think that fear can absolutely be productive. The way I see this manifest in my patients is that it can motivate them to get the appropriate cancer screenings like mammograms and colonoscopies, and also take medication they may be prescribed to reduce their risk of recurrence. It can also drive patients to modify their lifestyle behaviors because we know from research that a healthy lifestyle, things like exercising, keeping a healthy weight, and avoiding substances like alcohol can decrease the risk of cancer recurrence. So I absolutely think it can be productive.
Thank you. And next we'll hear from Namara.
So, I always get myself tripped up with fear and anxiety because they're very different. So, fear is designed to help us deal with threatening or unexpected situations, physical threat, if you will, in this moment. And anxiety, excuse me, which is what I understand your example to be referring to with MS, is more of that steady sense of uneasiness, that sense of dread, that helps us manage how we prevent or respond to or address specific circumstances that may not be manifest in this particular moment. So in terms of making anxiety productive, yes, I believe that we can. Our goal at best is to help our program participants acknowledge the emotion of anxiety, identify what triggers it, and to create steps or address the process in order to resolve that situation, and then work through how to best respond and navigate it. Thank you.
Thank you. And now Dr. Brosof.
So yeah, fear can definitely be adaptive. I think Namara made a great point about how we also in psychology differentiate fear from anxiety, where fear is in response to a current stimulus, and anxiety more being like an ongoing worry about future situations. And both can be adaptive because ultimately our fear system tells us when we are in danger. And we always tell our clients that fear and anxiety aren't things to completely avoid or to never experience. They are there to try to tell us something. So for people that I work with, people with eating disorders, they have an overactive fear response to food and fear of weight gain. And so we want to basically reteach them in therapy that these things are not actually a threat and can be tolerated. But again, the important thing is that what is the fear trying to tell us? So for the vast majority of folks with eating disorders, the underlying fear isn't really about food or about weight gain. It's usually the fear of the consequence that if they gain weight, for example, they'll be judged, they'll be rejected, they'll be abandoned. So when in my work, what we really work on is understanding what the fear is telling us, the function of the fear, and that's really important. And knowing that anxiety and fear absolutely can be adaptive in telling us kind of what's going on with ourselves inside.
Thank you. Yeah, those are very good insights. Oh, okay. So my next question is a bit of a follow-up, and I know some of you have already started to answer this one. Anxiety arises from our fears and is largely seen as unproductive or even counterproductive. And I know some of you have said ways that have mentioned ways where it can actually be productive as well. What are some anxiety management techniques that you would recommend? And once again, we'll start with Dr. Post and go around.
Thanks so much. So, in my patient population, patients diagnosed with breast cancer, fear and anxiety are just so common and completely understandable. And it can also be present once treatment is done, because at that point, we're transitioning to seeing our patients less. They're not coming into the office for months during that transition into surveillance or survivorship. And that transition, you know, a lot of people feel like at the beginning of treatment or diagnosis that they can't wait for it to be over. But that transition is often really challenging for patients. And that is actually the focus of some of the research that I'm working on now, funded by the NCI. And there are some really easy strategies that people can incorporate into their daily lives to help manage fear and decrease anxiety. I often teach my patients mindfulness techniques, as evidence supports that regular practice can reduce stress and anxiety. It can also help patients better tolerate symptoms that they may be experiencing. And this doesn't have to be intense meditation. We teach our patients simple, quick exercises like deep belly breathing, body scans, and present moment awareness that can all help manage the stress and uncertainty they experience with a cancer diagnosis. And for some patients, anxiety can be more severe, impacting their daily life and functioning. So for these patients, I would recommend connecting with a mental health expert for counseling, such as a social worker or a clinical psychologist. And I also may refer them to our department for oncopsychiatry for more in-depth management.
Okay, good points. Namara?
So I agree there are times when anxiety can result from our fears. And I really appreciate the comments that are being made here today, because it really elucidates the importance of being able to address those concerns with appropriate action steps, if you will. So for us, we encourage our program participants to create action plans. And we create steps cards for tasks and routines. We maintain a schedule, how to best use reminders, create habits, and establish a circle of support. And these things we found really do help lessen the impact of anxiety or fear of the future, or even concerns about immediate issues that can be daunting or paralyzing, especially to someone with cognitive challenges, or who's just generally, our brains are wired differently. So anyway, peer support, whether it's a one-to-one or in a group, is a safe space and excellent way to help someone articulate what they're anxious about, what their fear is, and having a way to articulate or express what's going on is often difficult, and particularly important for neurodivergent individuals, especially those with word-finding issues or expressive aphasia, for example. This gives them the opportunity to wrestle a potential monster in their head and make it more manageable. We also provide mindfulness activities, guided meditations, and self-care resources, which are also helpful in minimizing or mitigating the effects of anxiety and fear.
I love your
That's it.
recommendation for the steps cards, Namara, and it's something that I might just have to do for myself. So I was so glad to get the suggestion. Okay, Dr. Brosof.
Yeah, thank you. So as a psychologist, when we start to see anxiety as problematic is really when we see it kind of taking a lot of time. People are spending a lot of time worrying about a future situation or catastrophizing. It's keeping them up at night. It's keeping them from getting things done. They find it really paralyzing. And so that's kind of when we define anxiety as getting into counterproductive or problematic situations. And echoing Dr. Post, the first thing that we normally recommend for people are things like deep breathing and progressive muscle relaxation. And these are really simple activities that can take 5 minutes or less. There are great videos online. There's like dozens of them. And these are really things that can be used in the moment of an anxiety-provoking situation. Because what happens when we find ourselves faced with a lot of anxiety is our fight or or flight system takes over, which is called our sympathetic nervous system. That's what causes our heart to pound really quickly. It causes us to start to sweat, our thoughts start to race. And so in those moments when we're feeling really, really anxious, we aren't able to really rely on rational thought to get us out of those situations. And so why these techniques are really great in the moment is because they activate that parallel system in our brain, which is called the parasympathetic nervous system, to take over. So by slowing down our breathing, by relaxing our muscles, by lowering our heart rate, all of these things, then our minds will follow our bodies and our thinking will become clearer and less frantic. It will bring the anxiety down a couple notches. And so these things do take practice. So I tell people all the time that if they've tried them once or twice, don't be discouraged if it hasn't worked for you. I really recommend that people practice these things a few times a week as part of a regular routine. And again, these things can take less than 5 minutes a day. But that way, when you are faced with feeling a lot of anxiety, a lot of people have a lot of anxiety, for instance, right before they go to bed at night, they can really use those techniques effectively. The other thing that I really recommend for people who experience a lot of anxiety are a worry journal or worry time. And so these are set pieces that allow you to get out your worries and kind of put them in a box and move on from them. So you're not ignoring them, but you're giving yourself like almost like a timer, and you're allowing yourself to worry in that time, and then you're kind of moving on from it. Or with a worry journal, you're writing down your worries, and then you're checking in with yourself to see whether those worries actually led to the outcome that you thought. And so I'm happy to go into more detail about these for the sake of time. I won't right now, but I'm happy to answer questions. But these can be really effective techniques for different folks.
Okay, thank you. And I love that, the idea of a worry journal or taking time to worry. I think that is very important. Okay. In addition to working with patients, do you also work with the loved ones of patients to help them cope? Once again, we'll start with Dr. Post, move on to Mara, and then move on to Dr. Brosof. So, would you answer?
Great. Yes. So we absolutely work with caregivers. As a provider taking care of patients with cancer, family, friends, and loved ones are almost always present at the visits. And unfortunately, there's not as much support for caregivers as I would like there to be. For example, if I know that a caregiver is experiencing significant anxiety or fear surrounding their loved diagnosis, I can't directly refer them to a mental health provider as they're not officially my patient. But we're providing a ton of support to caregivers during appointments, over the phone, or the patient portal, because we do know from research that sometimes caregivers experience just as much distress, if not greater, than the patient. And the research lab that I work in also has a body of work dedicated to research that supports caregivers, and we're able to offer support and mental health resources to caregivers that enroll in these programs. Basically, seeing this gap in healthcare, we knew that we needed to institute some supports. And so we have, for example, a study ongoing where if caregivers sign up, they get 8 sessions of therapy, and we're comparing 2 different types of therapy for this particular study. So we are actively trying to document in the literature how important caregivers are, not only as part of the team that the patient relies on, but that their emotional health and well-being is important as well, and is often interrelated with the patient. So, many people say feelings are contagious, and we definitely see this. So we are seeking to improve our care of caregivers, actively. Thank you.
Thank you, and I'm looking forward to finding out what you find with the study, because I know it's very important to support our caregivers. Amara?
Thank you. I agree. I know in our community, finding appropriate supports for caregivers can be very difficult. for caregivers and family members. For BEST, we strive to include loved ones in the process to increase their understanding of what's happening to the person that they love and how to navigate really what's a significantly changed life. So, in addition to providing peer support and education for individuals, we also offer discussion groups, resources, and training, education, right, for caregivers and family members. So often things need new words, and we know that's very true for managing anxiety. Second Life is an excellent platform for the work that we do. In Second Life, we host guided meditations, mindfulness activities, and we also engage caregivers and family in respite gatherings. So as a part of the gathering, the group chooses a particular activity or a discussion topic for the next time that we meet. We do what we can to support family members because, as we just said, they are as affected, if not sometimes more so, than the individual going through the anxiety or change, whether it's cancer or mental health challenge or brain injury or whatever it might be. Thank you.
Thank you, Namara. Dr. Brosof?
Thank you. Yeah, we often involved loved ones in the treatment for eating disorders. Eating disorders are a really tough mental health issue to deal with, and so we really bring in all of the support that we can get for folks. So we're bringing in parents, siblings, significant others into sessions, and our job is really to help everyone understand what's going on. And often it's really scary for loved ones because they don't know how to help their loved one. That's kind of the thing that we see most often. So a lot of our role with loved ones is providing a lot of psychoeducation about eating disorders and giving them some simple tools, simple strategies to help them support their loved one. Obviously with the client there as well. And so really opening that line of communication. And so just by providing a little bit of education and kind of that reassurance, it usually provides a lot of relief for family members because they have some tangible skills at home to be able to support their loved one. They know what's going on with their treatment. And then obviously, we do very often recommend that loved ones seek their own individual therapy. And sometimes we recommend family therapy or couples therapy outside of the individual work that I'm doing with my patient as well. So that's pretty common.
Thank you. When I think about anxiety, I often think about how one's perception of self becomes threatened. For example, people often identify heavily with their career, but when they retire or become disabled, there is then this need to identify oneself in other ways. Of course, this happens with other situations. Those were just the examples I came up with. How do you think perception of self factors into the anxiety that the people each of you work with face? Once again, we'll start with Dr. Post.
Thank you. That's an excellent question. I absolutely agree that the perception of self is often threatened by a cancer or serious illness diagnosis and treatment. You know, many patients struggle with their new identity as a patient with cancer or as a sick person, and really many also just reject that identity because it doesn't fit with how their life was prior to this. I do think it can get better over time for patients who are treated and, you know, successfully treated for cancer and then can to their quote-unquote normal lives and reclaim some of that previous identity. But it is definitely more challenging for patients who live with advanced cancer where the disease is no longer curable. And for these patients, it can be challenging to incorporate this new identity in reality. And in those cases, I see a lot of grief and feelings of loss that patients experience. In the best case scenario, patients are able to integrate this as the new normal and move forward, although it's not a road they would have ever chosen for themselves. And, for some patients, this is an ongoing struggle. There's also the loss of control that is a big part of, the threat to the identity because, many of my patients were living full, very high-functioning lives before this kind of came and this wrench in their plan that they had for themselves, and they feel a real lack of control, which I think is also a struggle. But, again, I do return to mindfulness strategies often with my patients to work through these, tolerating this uncertainty and the way things are. There's also a different therapy approach called ACT that we use some of those exercises, which is, it's called acceptance and commitment therapy, but the name is a little misleading because it's not, you should just accept this diagnosis. It's really more finding a way to tolerate the way things are, even if it's not what you would have chosen. And again, oftentimes some people do need to, have a higher level of care and see a mental health provider. Thank you.
Thank you. Namara?
Thank you. I think Dr. Post brought up some really excellent points, especially in the context of a new normal. And this is something that affects brain injury community very significantly or deeply, because our identity as an individual, as a spouse or a parent, as part of a social group, etc., our identity is core to who we are, how we project ourselves, how we engage with the world around us. So it's natural that following such a significant change, either from the examples you gave or the patients that Dr. Post and I just embarrassed myself, that my co-panelists work with, because of a TBI, a person will feel anxious, very anxious about what comes next. Values, beliefs, family, community support, these are all important to our perceptions of self. So we have an Empowered Self class as part of our Project Peer program, and it's designed to help rebuild identity and identify changes and build on strengths. Because fundamentally, what happens with a traumatic brain injury is 1 minute I'm this person and the next minute I'm not. And that sudden sort of impact, and I appreciate things like having a debilitating disease or an illness that, there's early onset and it goes through stages, I think somehow gives us an opportunity to try and work on those issues. But when you are fall from a ladder or have an incident in a moving vehicle or any of the number, fall down the stairs, whatever the case might be, have a stroke, have a brain aneurysm, these things change who you are from one moment to the next. And as participants work through the steps and exercises, they are able to redefine who they are, creating a new normal, if you will. And then in turn, that lessens some of the anxiety they may be feeling. And then there's the whole topic of grief on top of that. So that's it for me right now. Thank you.
Thank you, Namara. Very good points. Dr. Brosof?
Yeah, thank you. I think that this is such an excellent question, and It really is very central to people with eating disorders. Eating disorders are unique among different mental disorders in that they often convince the individual that they need their eating disorder in order to be successful, in order for people to like them, in order to keep their career, and just function in general. And so, as a person has their eating disorder longer, it becomes absolutely central to their sense of self. So, a lot of the anxiety in treatment is not only about, changing their food, changing their appearance, but fundamentally changing how they view themselves as people. And so what we do is we work toward building a life worth living. So finding other activities or meaning outside of the eating disorder that create a full life for the individual. And so as we slowly build up, these different activities or communities, then that's when we usually see recovery really happen in folks. Yeah, thank you.
Thank you, Dr. Brosof. I'll let our transcriber catch up. Like that. Okay. Often with anxiety or fear, one may also experience grief, whether that be grieving a loss of ability to do things one might enjoy, the potential of missing moments with loved ones, or even a sense of loss due to something such as body dysmorphia. Now, we just talked about the loss of self, and of course, that is another thing that that can bring about quite a bit of grief as well. Could each of you speak to how grief affects the communities you work with? And once again, we'll start with Dr. Post.
Thank you for another great question. Grief is absolutely a huge part of caring for my patients with cancer. Patients grieve for what they've lost through this process and can potentially lose in the future. Many patients grieve about the physical limitations and changes a cancer diagnosis and treatment can bring, and as you mentioned, missing important moments and events with family and friends. There's a lot of what we call anticipatory grief, so that's like grieving into the future on the part of the patient as well as their caregivers when they worry about not being present for major milestones like children's birthdays and graduations, and also for life goals they worry they will not be able to reach. I can't think of a patient where I haven't seen grief come up at some point. For example, most of my patients are women, and so there's a lot of grief over changes in their bodies, losing their hair, or having a breast removed for breast cancer. So the physical changes are huge, and I think that's also partly because those physical changes are an outward sign of what they're going through. So my patients often feel like they don't have a choice of whether or not to share their very personal experience. I take care of a lot of parents, so people in the prime of childbearing and raising children. And so the grief there is about maybe not being able to have future children or any children at all if that hadn't been completed. And of course, missing milestones. But I see it even in my older patients who had plans for their retirement years that are now going to look a lot different. So again, a lot of my work is spent spending time with patients and working through the understandable feelings of frustration and grief, from the situation that they find themselves in.
Thank you. Namara?
The majority of people that we work with are navigating life after brain trauma, TBI, stroke, brain aneurysm, as I said earlier. We commonly hear how after such a trauma, they aren't the same person, right? One moment we're this person, and then something like a stroke or TBI occurs, and we wake up a completely different person. Memory issues, physical challenges, behavioral changes, and an inability to work any longer because of seizures or persistent and consistent headaches, and more, not only impact daily living, but how we see ourselves as well as how we are seen by others. So who am I now that everything I know about me is gone? What am I supposed to do now? Where do I go from here? Why did this happen to me? Yeah, so grief, the loss of all of that, it is a big part of what we deal with. We know that grief, if left unresolved, fuels depression, suicidal ideation, and not least, increased levels of anxiety and fear. It's been our experience that when offered appropriate peer support and the tools to succeed, people can define a new life that can be brilliant, exciting, and full of love. And that's why we focus on brain energy and not the brain injury. Thank you.
Thank you, Nemaya. Dr. Brosof?
Thank you. So obviously, grief looks a little bit different in my work than it does in Dr. Post's and Namara's people that they work with. But it's interesting because eating disorders become woven into the sense of self in such a profound way that losing the eating disorder usually produces a large amount of grief in and of itself. And so we talk openly in treatment what that loss is like. For certain clients, we actually hold funerals for their eating disorders to talk about the loss of that identity. And then on the flip side, as you mentioned, once someone is closer to recovery, they often have a lot of grief about all of the things that the eating disorder made them miss out on, like social events or career opportunities. Some folks with eating disorders who have to attend residential treatment where they live at a facility 24/7 for months have to grieve the time away from their life that they lost to their eating disorder. So a lot of my job as we navigate recovery is holding space for that grief and knowing that it will come up in different ways at different points for people, and just being really open to that. Thank you.
Thank you so much for answering all my questions. And I want to open things up to our audience because I'm sure that they will have some great questions as well. So with that, if anyone has any questions, feel free to type in the chat. We'll also take questions by voice. Just let us know if you'd like to respond that way. Okay, I have a comment from Mook Wheeler. She says, I want to say this as someone living with clinical depression and anxiety. You all agreed that anxiety is paralyzing. I also want to say that anxiety lies. Anxiety tells us lies. It distorts and warps what we see or think and always affects every decision and action in a negative manner. It can make you think in a wrong or untruthful manner. It can taint perspective, reminding yourself constantly that anxiety lies is very necessary if you are caught up in a journey with it, and your loved ones need to know this too. Okay. Yes, and thank you, Sherkin, for mentioning. Yeah, please preface your questions in chat with a Q or say if they're a question or if they're a comment, and I'll give our presenters a chance to respond to that comment if you'd like to.
I can respond. I thank you for sharing that. I think it's so important for people to share their own experiences with clinical anxiety, clinical depression. It gives other people a lot of hope that they aren't alone and that other folks out there are dealing with similar challenges. And anxiety absolutely lies to you in many, many ways. And that's what's so challenging about living with things like depression, anxiety, and eating disorders is that, that is what your brain is telling you is reality. And it's hard to fight that. And so, yeah, just thank you again for sharing that.
Just real quick, if I can, I think this goes back to or ties into that whole idea of negativity bias, and I really think that though it's a difficult thing to kind of navigate through, being aware that it does tell us untruths is why we can't make rational decisions when we're anxious, and having someone to work through that with you, with us, whether it's a loved one, a professional, or in a peer support group, addressing that is a good thing. So, but yeah, I agree. It does also lie to us.
Okay, I just want to comment because Sherikan had mentioned also, please preface in chat if you do plan to answer via voice or if you're going to ask a question or comment via text. Okay, and Gentle Heron is saying, thank you, panelists, for many wise insights. She has a question. I suspect much of what you said about the population you work with applies to many other groups. Are there some people who should not follow your suggestions, and why?
I can jump in there, just for, what we do at best can be in fact adapted and is certainly appropriate for other groups, in terms of challenging or navigating their own anxieties and their fears. So I just wanted to share that quick.
Yeah, I would agree. I think, everything that my fellow panelists have spoken about can absolutely be adapted to other populations. Certainly the recommendations I was making for, and I think Dr. Brosof did as well, for simple mindfulness techniques or strategies, those, I always tell patients when I'm talking about this, that it's appropriate for just about anybody. It can help with everyday stress, reducing that, handling that in the moment, as Dr. Brosof mentioned. But, with my patients, cancer is obviously on the forefront of their mind, but they're still trying to navigate all the other challenges that people face and have anxieties about. So I really try to talk with my patients about the fact that these strategies are useful just in general, even if today they're not worrying about their cancer or feeling anxious. Thanks.
Okay, we still have time for more questions. So. All right, NSTIG G8R has 3 questions, I guess, 3 Qs. In April 20, okay, pronounced instigator. I'm sorry, I'm horrible with that. So he says in in April 2021, I moved to a new state. No friends, family, just myself. 2 months later, I spent 11 days in a coma. Renal and respiratory failure, sepsis, MRSA, and necrosis of the small intestine. For the first 17 days, staff had little hope for my survival. April 2023, sepsis, arthritis caused me to become a below-the-knee amputee. I'm finally living on my own, using a K3 prosthetic now, and trying to get work. My goal every day is to make one stranger smile. Yeah, I've been through a lot. I feel for you. So, I guess I would say that's probably more of a comment than a question, but if any of our panel would like to respond.
I will, because my keyboard is rebelling. I just wanted to say that I really love that idea. What a great energizer to refocus, right? And to make one person you don't know smile. I just think that's beautiful, and I thank you for sharing that, Instigator.
I agree. I would say, finding a way to have, as my panelists had mentioned, a full life full of, joy and purpose is absolutely possible. And it can be a great way to turn your attention and your energy to something aside or besides the challenges that you're facing.
Yes, it's so good to be able to redirect your energy, and very, very powerful. Okay, anyone else have any comments or questions? Oh, okay. Pecos Kid says, I think this was a brilliant panel and discussion. Thank you all so much. Instigator is saying, every day I wake up is a great day, much better than the alternative, and that's how I set my positive goal every morning. Idico Spector says, learning to live no matter your situation is very important and healthy to our own mental health. I think those are all great suggestions and great comments.
And I have one more comment I can chime in. I think that, all of the panelists today, we all work in very different areas, but I think a lot of the themes among the people that we work with are similar, as Gentle Heron kind of pointed out. And so I think keeping in mind that shared humanity and that, everyone is going through different struggles, and, some people are struggling more than others, but keeping that positive attitude and, coming together in communities like this can be really powerful. So thank you so much for having me on the panel today.
Second,
I agree. Sorry, Namara.
No, go ahead.
I was just going to agree with Dr. Brosof. I really appreciate everyone having me here and allowing me to share my perspective, and also kind of building off what Dr. Brosof said. I think part of dealing with fear and anxiety is understanding that this is something that all humans have innately as a way, hearkening back to what Dr. Brosof said about the stress response or the fight or flight response. It is a normal response when we feel threatened. And so, I like to try to talk with my patients just to normalize their experience, that it's understandable, it's common. Many people struggle with this. It's usually commented that up to 60% or 2/3 of cancer survivors struggle with fear of cancer recurrence. And we know that anxiety and fear can have negative impacts on quality of life. So it's really about validating patients that this is an understandable and normal experience, but finding ways to live better despite the uncertainty that so many of our patients face.
Yes, thank you to all our panelists, and I want to thank all of you in the audience who had great comments and questions, and especially thank the transcriptionists here today who help us out so much. Are there any other questions or comments?
Okay, thank you very much. And audience, we have a little over a half hour till our final presenter. Our final presenter is scheduled to start at 3 o'clock SL time, so top of the next hour. So you're welcome to take a break, do some mindfulness, some deep breaths, have that sip of water, whatever it works for you, relax, and then we'll see you back here in about 35 minutes for our final presentation. Thank you.